Hello everyone, I'm Daniel Steele. I'm coming to you from the traditional, ancestral, and unceded territory of the Musqueam people. And this lecture is going to cover utilitarianism and equity. And this is going to connect up with the Marseille and Kahn reading from week 2 of this semester. All right, so first of all, what's equity? Obviously a big complex question that we won't fully explore in this lecture, but I wanted to just start off with a simple definition of equity. As we'll see, there are more aspects of equity than are covered by this definition. We'll see that later in the term, but for now, let's just start with this one. So here's a definition that's quoted in the reading, and it says, equity means dividing resources to reduce disparities in health status among different groups or strata: poor, women, rural areas, ethnic, racial minorities, etc. So the idea is that equity in health means that you're trying to distribute resources so that disparities in health outcomes are reduced. This definition is sort of limiting equity to resource distribution, or what in philosophy would be called distributive justice. As we'll discuss, there are many other aspects of equity that we'll talk about later in the term, but for now we'll go with this definition. So what then is the connection between utilitarianism and equity? Now, as we saw in the previous lecture, utilitarianism is the idea that you should get the most benefit, the most well-being, the most sort of quality-adjusted life years that you can get, the most population health you can get from the budget, the resources that you have. Now, according to this view, Marseille and Kahn say that no special claim accrues from alleviating inequality. In other words, what utilitarianism cares about at the end of the day is the total quantity of well-being, not the distribution necessarily. But then there's this caveat, except the exception is when privileging vulnerable populations or those with less access to care is an efficient means to maximizing overall benefit. And in fact, if you look at the figure 1 in the Marseille and Kahn reading, they give this sort of rundown of how utilitarianism relates to a number of other ethical ideas in public health. And they suggest, in fact, that the correspondence or the convergence between utilitarianism here and equity here is, in fact, pretty high. So let's see why they think that. Why do they think that there will often be, in fact, a correspondence between equity and utilitarianism? Well, to understand this, it's helpful to sort of take a step back and understand a classic utilitarian argument that goes back over 100 years for why economic inequality is bad. In other words, why it's better to have a society that's more economically equal than one that's really unequal. And this is the idea of diminishing marginal utility. This is the idea that the amount of well-being a person derives from some resource, whether it's money, whether it's healthcare, or whatever it is, that the amount of benefit that you get from this is less when you already have more of it. So the more of this, say, more money you have, the less value to you of getting another $100, let's say. So, for example, if you were to give Bill Gates, $10,000, it's not going to change his life, his quality of life, his well-being really one bit. He has so much money that another $10,000 is just about nothing to him. Whereas, say, students in this class, if you got a bursary for $10,000, that would be a big deal. That might really help you out. Maybe you don't have to work as much and you can spend more time on your studies, and that will help you in your life and, be less stressed and maybe do better in the program and all these kinds of things. So how much value you get from the money depends on how much money you already have. And this has the consequence that highly unequal distributions of resources are inefficient. That is, they're going to tend to generate less well-being than could be had from a more equal distribution. So this is a key utilitarian argument, a classic utilitarian argument for why economic inequality and in general extreme inequalities of resources is typically a bad thing. And this figure here is just illustrating the idea of declining or diminishing marginal utility. Here, for example, if you thought one is like $100,000, this is $200,000, going from zero income to $100,000, huge improvement in your well-being. $100,000 to $200,000, well, it's still an improvement, but not as big. If your income jumps then from 200, say, to 300,000, well, it's a little bit, but not much. And 300 to 400,000, well, hardly any change at all. And that's sort of the idea there. Okay, so then let's get back to this efficiency. Remember the key idea of utilitarianism, getting the most bang from your buck, getting the most well-being that you can from the resources that you've got. This is this key utilitarian idea. And so think about how that then connects to equity. So how can efficiency and equity coincide? Well, they coincide when the action that produces the most quality adjusted life years from the resources that you've got is also the one that disproportionately benefits the most disadvantaged groups. And this is actually something that can happen quite a lot because, again, if you think back to this idea of the diminishing marginal utility, the people who already have a lot of resources don't gain as much as the people who have less from getting more resources. And so policies that sort of specifically aim at benefiting people who are more disadvantaged will oftentimes be more efficient in terms of producing more overall well-being. So a good example to illustrate this idea, it comes from debates in Canada about whether there should be a national pharmacare program. That is a program that would provide coverage for pharmaceuticals, if you that you get outside of a hospital. So if your physician writes you a prescription and you go to a pharmacy to get that prescription filled, that's not going to be covered by your provincial care card. If you don't have supplementary private insurance, say through your employer or that you've purchased yourself, then you essentially just have to pay out of pocket. And so a national pharmacare plan would essentially make your healthcare card basically also cover these prescriptions. And there's a number of people who've argued, a number of health economists who've argued that, in fact, that kind of system would be more efficient than the system we currently have, and also to sort of alternative ways of trying to address this issue of access to pharmaceuticals. It would be more efficient, and it would also benefit the lower income people the most. So this would be an example where efficiency and equity would coincide. And one of the reasons for this is that if you had a national pharmacare plan, that would make it possible for the government of Canada to essentially negotiate with pharmaceutical companies and sort of take the sort of whole population of Canada and sort of bargain with them for lower prices. Whereas in the current situation where you have many different insurers that are, sort of a patchwork that are covering different populations, each of them negotiating with the pharmaceutical companies for prices, in that situation, there's, the pharmaceutical companies are in a sort of much better bargaining position and can get charge higher prices for their drugs. Okay. There are other reasons too, like administrative costs, but I won't go into those in detail. The point here is that there are arguments that for a national pharmacare plan, it's going to be equitable and it's going to be efficient. But this is not how it always works. There's some cases where utilitarianism and equity can diverge, and that can happen when the least advantaged get less benefit from resources than others. That's one way that can happen. So here's a simple example, sort of more of a medical example. I'll consider a more public health example on the next slide. But in this example, if you have two COVID-19 patients, both of the same age that need a respirator, but there's only one respirator available, but one of these patients is healthy aside from COVID-19, but the other patient has a serious pre-existing health condition. Then in that example, the patient who doesn't have the pre-existing condition, the patient who's otherwise healthy aside from COVID-19, has a better chance of recovering if they're given the respirator. And so from a utilitarian standpoint, it makes more sense to give it to that person because that person stands a greater chance of recovering, and hence you're more likely to get more well-being, more quality adjusted life years if you give the respirator to the person who does not have the pre-existing condition. And this type of situation sort of illustrates the connection between equity and something that's called by philosophers prioritarianism. This was something that's also mentioned in the Marseille and Kahn reading. And prioritarianism is also an idea that's going to come up later in the term when we do specifically look at health equity as like a central topic for a class. And we'll look at some different views about this. And one of the ones we'll read about actually has prioritarianism as one of its main principles. So prioritarianism is just the idea that a fair distribution of resources should be one that prioritizes the least advantaged. And as the example in the previous slide about the ventilator illustrated, prioritizing the least advantaged isn't always the most efficient thing to do. And there are other examples that are sort of more population health type examples that illustrate the same point. So, for example, people living in rural areas often have less access to healthcare. There are fewer hospitals. The hospitals tend to be smaller. The hospitals might not have as many sort of specialist services. So maybe if you have cancer, you have to go travel a long distance to a city or something to get treatment for your cancer. And so there's this disparity in terms of access, with the rural folks having less access. At the same time, it's clear that it's more efficient to concentrate healthcare resources in urban areas. Obviously, there's more people there, so more people are going to get to use them. And also, urban areas tend to have more connections to, in terms of transportation, so it's easier for other people to get to those areas. And so in this example, efficiency favors the concentration of healthcare resources in urban areas, but prioritarianism would prioritize more resources in rural areas. And so this is an example of what's sometimes called an efficiency equity trade-off. And as we'll see later in the term, efficiency and prioritarianism are sort of two issues that are important when thinking about health equity. So this gets us back to the main theme of the Marseille and Kahn article. And their main theme is that although utilitarianism isn't the sort of ultimate be-all, end-all of ethics in public health, that it's really it's at a higher status than all the other approaches. That's the view that they take, and that any sort of decision that goes against what utilitarianism would recommend requires some really strong justification. So here's a quote from the paper. They say, "We do not propose that utilitarianism is the only legitimate guide. However, we do suggest that it would be the point of departure for further analysis. Because of its intrinsic ethical dimensions, efficacy is not merely one criterion among many. The promotion of human flourishing is a central goal of most ethical systems. Attaining the greatest population health available with given resources is consonant with that flourishing. Thus, decisions that diverge from pursuit of that goal to promote other ethical values should be acknowledged and justified." To put it really simply, do what utilitarianism recommends unless you've got a really good reason not to. And according to Marseille and Kahn, it's not just enough to cite some other values such as equity or what have you. It's also, they think, necessary to demonstrate explicitly how much population health you're losing by, for instance, advocating or prioritizing equity rather than efficiency. And then to be explicit about that and to be able to justify it. And I encourage you, and we'll discuss this in class, encourage you to think about this in relation to the example about male and female condoms in HIV prevention. This discussed on pages 5 and 6 in the Marseille and Kahn article. And so go read about that and be ready to discuss that in class. And then, I will see you then, and goodbye.